Thank you for this comment. So, patients have started to record these interactions they're having with these doctors, and then they're taking these recordings to the AG's office, and AGs are investigating doctors for fraudulently diagnosing people with an opioid use disorder they don't have. And Suboxone, well, let's talk about opioid use disorder. So, opioid use disorder was created as a Suboxone marketing tool. In fact, the psychiatrist involved in creating that phony diagnosis, well, they were paid by the makers of Suboxone and other pharmaceutical companies involved with the whole addiction space. So, this is just wild that doctors are afraid of the DEA. And I get it, you're afraid of the DEA, but you're not afraid enough to harm your patient. And that's why I have to call out the dishonest doctors. If you don't want to write the script, then don't write the script, but it doesn't give you carte blanche to abuse your patient. Let's talk about the millions of people who have lost their teeth because of all forms of oral buprenorphine. Why aren't we having this conversation? Because people not only have lost their teeth, they've developed this mouth trauma, and that mouth trauma has turned into oral cancer and throat cancer. And I know there's going to be doctors on here who say, oh, that's not true. But that's what you also said when I started promoting the Suboxone Dental Decay lawsuit. Doctors would be in denial that oral buprenorphine is linked to catastrophic dental decay. Well, guess what? I've got about 600 law firms who stand behind me. Thank you for supporting our efforts at the Doctor Patient Forum. Remember this hashtag, don't be duped into bupe.